Hi class, for today's topic we gotta pick a disease that affects either the male or the female reproductive system, and I choose PID, which stands for pelvic inflammation disease. And what is this? It's an infection of the female upper reproductive organ like uterus, fallopian tubes, and ovaries. It is primarily caused by untreated sexually transmitted disease (STIs). Most common AIDS that can most likely cause this will be chlamydia and gonorrhea. Symptoms. What does the symptoms include? They can range from mild to unnoticeable or unnoticeable to severe. It depends on when they occur, and they usually include lower abdominal or pelvic pain, sorry, pain, unusual or heavy vaginal discharge, sometimes with a foul odor, bleeding between menstrual periods or after intercourse, Um, pain or burning during urination, pain during sex, fever and chills in severe cases. The fever and the chills is just for like severe cases of PID. Okay. And then I'm gonna explain long-term complications if this is left untreated, and I would recommend, first of all, if you have any of the above symptoms, to go check yourself or to go to your primary physician, and get some tests done, because it can become severe, or like just for preventing any type of disease. If you're sexually active, I would like say that you get checked down there and up here too, um like regularly. Like I think it's like every 6 months, depending on like your physician, but usually like I think you should just get checked. Okay, well, anyway, if left untreated, PID can cause permanent damage, including the formation of scar tissue and abscess, pockets of infected fluid. Sorry, my kid. Anyway, sorry about that. If this PID gets left alone and not treated, it can cause fertility and ectopic pregnancy. And this is a life-threatening condition that is where the egg fertilized outside the uterus, and that can cause like health problems for you, and you can have a miscarriage. Okay, so we also have one thing that could affect it will be chronic pelvic pain, and this will be like ongoing pain that can last for months or years in your pelvics. Okay, treatment for PID is this is a treatable condition, and medical intervention should be sought immediately if you suspect an infection. And like I said, you should like just get checked, male or female. Like they should just get checked like so often. I don't know how often if male should get checked, but I usually do not like I go to my doctor regularly, so I don't know. I do usually do like every 6 months or something like that, or every 3 months. But like we just talk about my health and stuff. Anyway, um, treatment usually involves antibiotics, and to clear the infection, it is crucial to compare prescribed medication. It's complete. It's crucial to complete all prescribed meditation, even if your symptoms go away after 3 days and you're antibiotics are supposed to be for 10 days. Yes, do the treatment, because if you don't, it can lead to your body not stop responding to those antibiotics, and then it's just gonna make it harder for you to be treated. Okay, and don't just say, "Oh, I'm gonna say these antibiotics for the next time I'm sick." No, that's not how it works. Okay, don't do that. I don't recommend doing that, and I would like you should just go see a doctor if you feel like you need antibiotics, and talk to a provider about it. Anyway, so yeah, treatment, yes, involves medication. Additional mm, and also, like, if you have these, like, your sexual partners should be tested and treated, and to prevent infection, or like to make sure they don't have what you have, and all that. And please be safe out there, whether you're a male or a female. Just protection, unless, like, you really know the person is not doing anything that you should be worried about. But and also, always go to your doctor. That's all I gotta say. So that's it for my video. Have a good day.